In this video, we will describe the larynx. We've already indirectly discussed the larynx in previous lectures, specifically describing the difference between the conducting and respiratory portions of the respiratory system. But in this video, we're going to focus on the cartilage, bone, and membranes that make up the physical larynx. So now I'm just going to change screens briefly and focus on the different bones and cartilages. So we'll start superiorly and work our way inferiorly. The first structure of the larynx, if I zoom in, is the hyoid bone. The hyoid bone coincides with the third cervical vertebrae, which you can see I've removed C3 down to C7, so we can get a nice view from the posterior position in a minute. Below the hyoid bone, we have the thyroid cartilage, which is the broad cartilage here anteriorly. And this is the cartilage that gives the quote-unquote Adam's apple in the man. And that's because where the two pieces of the cartilage merge in the midline for males is a much sharper angle, so it protrudes more through the skin, versus female have a much broader angle. Below the thyroid cartilage is the only fully circular, what is called cricoid cartilage, which if I turn the model, we can see how it makes its way all the way around on both ends, but the thyroid cartilage you can see is interrupted in the middle on the posterior side. In between the cricoid cartilage here and the thyroid cartilage here, we have a membrane, nicely called the cricothyroid membrane. This membrane is normally just holding these two cartilages together, but in an emergency breathing situation, this is where a cricothyrotomy or an opening in this membrane can occur to make a secondary airway if at any point superior to this location is blocked. Now if we turn the model towards the posterior position, we can see that we have some of the mucosa from the laryngopharynx, so I'm going to hide that. And now we can see the epiglottis here, which is within the center of the larynx. And again, this is a protective structure that will fold towards us in this position, blocking this opening into the respiratory tract and forcing food or liquid posterior here into the esophagus. The final cartilage that I want to talk about are these small arytenoid cartilages, which have a triangular morphology. Now there are muscles that I'm not going to go through in this lesson that attach to these various cartilages, whether it's the cricoid, thyroid, arytenoids, or even the epiglottis. And when that happens, that can change the overall shape of the larynx. Because in addition to allowing air to simply go through and into the trachea and out to the lungs, inside the larynx, roughly around this location, we have what's called our vocalis muscle and vocalis ligament, or vocal ligament. This muscle and ligament is what allows for when air is passed when we speak to come back through and changes our pitch, and is really what's allowing our sound to be produced. These muscles that attach at these various cartilages aid in changing the shape of that ligament and thus changing the way the sound comes out of our mouth.